And a big focus of the debate on Capitol Hill over rising drug prices has involved insulin, in large part because so many people need it and some have to pay a lot for it. Well, today, Cigna said that it is capping what some consumers will have to pay out of pocket for insulin. Bertha Coombs has the details.
Cigna says it wants to help its 7,000 diabetic members on commercial health plans get more affordable insulin. It's now dropping copays to $25 for a 1-month supply from an average of $41. Executives at Cigna's pharmacy benefits unit, Express Scripts, say the move comes after negotiating new discounts from insulin producers.
It really wasn't until probably the last couple of years that we really started hearing about issues of people rationing their insulin because of high out-of-pocket costs. And from our standpoint, that kind of snuck up on people.
But why now? Insulin prices for patients with type 1 diabetes have doubled since 2012, according to the Healthcare Cost Institute. And that's become a key focus in the drug price debate in Washington. In the last 2 months, congressional committees have launched probes specifically looking at insulin prices.
When it becomes a more discrete, concrete problem, it's something that people respond to versus the macro. Drug prices are too high. So, but when you specify which one, then there are actions that either the government can take, the pharmaceutical manufacturers can take, or the payers can take, or all three.
Last month, the nation's top insulin producer, Eli Lilly, launched a half-priced generic version of its blockbuster drug, Humalog. Consumers will benefit if others follow Lilly and Cigna, says University of Pittsburgh's Inma Hernandez.
It doesn't necessarily have to be this type of copayment reduction. For instance, one may think that instead of lowering copays, they could just lower list prices, because that could also benefit in uninsured patients, which are probably the ones that struggle the most because of very high insulin prices.
Cigna says the insulin makers are picking up most of the cost of the copay reductions, but it will still be up to employer and group plan customers to decide whether they'll implement the program for their members. For Nightly Business Report, I'm Bertha Coombs.